Hello, welcome back to Cortex Bloom, where we work on making medical concepts simple. Today, we'll be talking about the ANP and BNP pathways. So let's jump right in. Alrighty, so the ANP and the BNP pathways. The gist, I guess, the function of these pathways is to bring better blood pressure control, specifically when our blood pressure is high, or really more generally, when our heart is having to work really hard. When our heart is working, just over time, not having a good time overall, the ANP and BNP pathways kind of help to relieve some of that stress. It'll work on relieving that stress by, one, reducing the amount of resistance the heart has to work against, but two, also reducing the volume that the heart has to pump. So that's kind of how that works. And I think a helpful way to think about it is that it works almost opposite, I would say, to the RAS system, right? Because the whole purpose of our renin-angiotensin activation system is to bring our blood pressure up, or respond to maybe like a low blood volume situation or a poor renal perfusion situation. So in a way, the ANP BNP pathways work kind of opposite to that. So let's jump into it. So typically, this pathway will be triggered by us either experiencing an increase in volume overload, or an increase in venous return. Okay, so some examples of volume overload would be if we suddenly have gotten a bunch of IV fluids that were dumped into our circulatory system. Maybe we got IV fluids, maybe we got a couple liters of blood. And so now we have a much larger volume than we're used to circulating in our body, and our heart has to figure out how to deal with it. An example of increased venous return could have to do with maybe a positional change, right? Some of the things that we've talked about previously, especially with our RAS system, is how different mechanisms like squatting can, or even standing, can change how much venous return we have coming to the heart. So positional changes are one way that we could have an altered venous return that our heart now has to kind of contend with. So with the volume overload and the venous return increasing, our heart will respond in kind of two related ways. One is the walls of the atria and the ventricles will start to stretch. And the reason why they're stretching is because they want to enlarge or stretch the chambers of the heart, just to accommodate some of that extra volume and venous return that they have to deal with. Enlarge the chambers. Yep. So when we're enlarging chambers, we are seeing kind of two mechanisms. One of those mechanisms is the atria are stretching, right? Our left and our right atria are stretching. And what happens when that stretching occurs is our atrial myocytes will release a hormone called ANP. And ANP stands for Atrial Natriuretic Peptide. Okay. The other kind of mechanism that's happening is our ventricles are stretching, right? Ventricles stretch. And what we have here is our ventricular myocytes now are going to be releasing another hormone called BNP. And BNP stands for B-type natriuretic peptide. So ANP and BNP will go on to stimulate receptors all over our body. So let's talk about those receptors. So one of the first receptors that I think it's appropriate to talk about is the receptor called NPRA. NPRA. And this one's pretty cool because it can be found in a few places. One of those places is in the kidneys, and another is in smooth muscle of our vasculature. So smooth muscle is specifically found in the walls of our blood vessels. I'll put smooth muscle in parentheses. Smooth muscle. Okay. So the way it works in the kidney and the vessels is NPRA will activate an enzyme called guanyl cyclase. And guanyl cyclase is pretty cool because it's involved in the conversion of GTP to cGMP. And the reason why that matters is because cGMP is involved in a few important functions. So 3 functions to be exact. One of those is a process called natriuresis, which is literally sodium excretion via the urine. Okay. Another mechanism it's involved in is going to be diuresis, and this is just water excretion in the urine. And then finally, it's involved in vasodilation, which, as we know, is going to be a relaxation of the blood vessel walls. So let's take a step back and put this into context. We talked about how the ANP BNP pathway got kicked off because of an increase in volume overload and an increase in venous return. So if we look down at kind of what the NPRA receptor is doing, it kind of tackles both of these issues. So with us excreting both sodium and water, we are getting rid of that volume from our body. So getting rid of that volume allows us to decrease the overall volume overload that we were once having to deal with. The other cool thing is this relaxation, this vasodilation. When we relax the vessel's walls, we decrease the force that we're pushing on the blood within those vessels. And think about it more broadly, we are decreasing the amount of systemic vascular resistance on the venous blood that's coming back to our heart, specifically back to our right atrium. So relaxing the blood vessel walls is what allows us to decrease our venous overload. Because again, that venous blood, it has to really relies heavily on the constriction of the veins to kind of help pull that blood back to the heart. So if we are vasodilating, that venous load is going to decrease significantly. So if we are having a situation when we are decreasing pressure, okay, right here, decreasing volume, and we are decreasing pressure via a lower venous load, we are going to overall go ahead and drop our blood pressure. So this is one of the ways that the ANP BNP pathway can kind of help lower and correct our blood pressure. So taking this kind of to the next step, ANP and BNP continue to act on a few different receptors. So another cool receptor that they work on is named similarly, and it's called NPRC. NPRC is pretty simple. What it does is it will bind, let me put bind over here. It will bind to our excess ANP and BNP and help degrade them. Again, this is important because it is a negative feedback mechanism for the ANP BNP pathway. It's what helps us prevent us from overcorrecting that blood pressure, right? And making a patient hypotensive, because, that's just as bad as a patient being hypertensive, just for different reasons. Moving on, the ANP and BNP hormones also act on receptors within the kidneys. And what they do in the kidneys is kind of two things at once. One is they will dilate our afferent arterioles. So afferent with the A means blood that's traveling towards the kidneys, right? So it'll dilate the amount of blood coming towards the kidneys, dilate the vessels for the blood coming towards the kidneys, and it will constrict the efferent, if I can spell efferent, our efferent arterioles. And E for efferent helps us know that this is pertaining to blood that's traveling away from the kidney. So there are these pressures that are called Starling's pressures. And basically, Starling's pressures operate on the principle that if we make sure that the pressure of the blood inside capillaries is lower than the pressure of blood leaving the capillaries, we enable the kidney to do filtration. Okay, so pressure. Excuse me. Let me reverse this. Yeah, perfect. No, that's actually right. Okay, perfect. So pressure inside the capillaries should be less than pressure outside of the capillaries, and that's what allows for filtration. So if we kind of put that into context here, when we dilate the blood vessels that are bringing blood towards the kidney, we are effectively lowering that pressure, right? Because it's decreased resistance of those vascular walls. So we're going to have a lower pressure inside our capillaries. And when we're constricting our efferent arterioles, right, we are essentially increasing the pressure of that outgoing blood. Increasing the pressure in the outgoing blood from the capillaries. So again, these two kind of mechanisms together are what enable glomerular filtration. And again, to step back a little further, it explains how the ANP and BNP pathways help us filter blood by regulating pressures. Moving forward, the ANP BNP hormones, they also will act on receptors in our vasculature. We kind of talked about that already. If we go and look back at NPRA, we talked about this vasodilation, feature. And so with vasodilation, we are going to have we are going to have decreased vascular resistance, and decreased afterload. So why is that? In order for, essentially what afterload is, it is the amount of systemic vascular resistance the left ventricle needs to overcome in order to shunt blood out to the rest of your body. So if we lower that systemic vascular resistance by vasodilating our arteries, we are effectively also decreasing our afterload. And decreasing both of those things, again, is what helps us kind of decrease the amount of strain that our heart is under. Okay. And then the last thing is looking at how ANP and BNP affects our heart. Okay. So we've talked about how we have a decreased afterload, right? Afterload. We talked about that here, right? And then we also talked about how ANP BNP helps us decrease our preload. And it decreases our preload by reducing our venous return, right? Again, by vasodilation. So decrease preload, decrease afterload. When we look at those two things together, we see that we effectively are reducing the amount of blood volume the heart needs to contend with at one time. We're not decreasing the amount of blood volume in the body overall, right? Because the patient isn't bleeding out, but we're reducing how much blood the heart has to work with during the cardiac cycle. And because we're decreasing the blood volume that the heart has to deal with during the cardiac cycle, we're also just decreasing the amount of cardiac stress it has to deal with overall. And that kind of sums up our ANP BNP pathways. The one thing I'd like to draw your attention to is this. You get a good color. With our, right here, our BNP. Sometimes when this is overactive, it's because we are having heart failure due to ventricular stretching, okay? And so when we have that, we can treat it. And I guess the site of action would be right here. This is where we give medications that would mimic BNP, okay? So our heart's working really hard because we're having this ventricular stretching, right? Think about like our ventricular hypertrophies. The treatment for that is to give medications kind of in this part of the pathway that mimic BNP. A common medication that we'll see often is called nesiritide, and it's spelled Nesiritide. There are plenty more, but that's just one that we see commonly. And this wraps up our discussion on the ANP BNP pathways. I hope that helped. Thank you. Have a great day.